Welcome to Facts TV News, where everything is true. Police announce traffic changes in Port Antonio. Police have announced several traffic changes aimed at alleviating traffic congestion in Port Antonio, Portland. According to the police, the changes will occur along West Street and inside the Port Antonio Marina between the hours of 8 a.m. to 5 p.m. or as the need arises on the following dates: Wednesday, September 1, 2021 to Saturday, September 4, 2021, Monday, September 6, 2021, Thursday, September 9, 2021, and Friday, September 10, 2021. The police also said that West Street will be converted into a one-way road for all westbound traffic with the exception of motor trucks. Motor trucks will not be permitted to access the marina and will continue their journey along West Street, both east and westbound. The no parking designated areas along West Street will remain in effect. In regards to the Port Antonio Marina, the police said with the exception of motor trucks, all eastbound traffic will be diverted through the west gate of the marina and will exit through the east gate. Parking inside the marina will be restricted to the designated parking lot or to one side of the roadway as determined by the police officers on the ground. The speed limit inside the marina is 20 kilometers per hour and must be observed by all motorists accessing the marina. No overtaking is permitted inside the marina. The flow of traffic inside the marina will be one way and will only accommodate eastbound traffic. According to the police, the changes are being enacted by the Superintendent of Police in charge of the Portland Division under the Authority Section of 22 of the Jamaica Constabulary Force Act. Prime Minister Andrew Holness update the nation on current COVID situation.
Thank you, Naomi. Good evening, my Jamaican family, watching here locally and in the diaspora overseas. Based on the latest report from this morning, Jamaica recorded 351 new cases of COVID-19 and a test positivity rate of 40.6%. Now, I'm extremely saddened by the deaths of 31 additional persons. This, of course, would be 31 persons deemed to have died from COVID-19 over the last 7 days. And nevertheless, this is the highest reported daily number since the pandemic began. I think we have now reached the point where almost everyone has had someone close to them, a family member, a friend, a colleague, that would have been impacted by COVID to the point of even dying. I offer my sincerest condolences to all who have lost loved ones to this very dreadful disease. The real issue for us is how to prevent the spike from happening, how to keep that spike below capacity, and if it gets above capacity, how to bring it down very quickly. That is the immediate and ultimate solution. Yes, in the long term, without question, the government must invest more in its health capacity. The truth is, we have underinvested for decades, for generations in health. The pandemic is showing that up. It's testing it. And the government has to think about that very carefully now, how we build a robust and resilient health infrastructure. So that is actively under consideration by the government. It will obviously mean, greater consideration for the budget going forward. And we probably will have to mobilize. I was having some discussion with health professionals this morning. We probably will have to mobilize a health transformation team to take a serious look at resourcing healthcare, improving our infrastructure and capital capacity to address these issues and improve our resilience. But I just want to be clear on the argument that when we are in these kinds of situations where spikes will occur, the solution is not always going to be to provide more. The solution, first and foremost, has to be how do we get our citizens to change behavior and therefore reduce risk to themselves and risk to the population and keep the numbers of infection low. And that's what we have been doing all along. It's a balancing act. As I've said before, some people want to live and some people don't want to die. And it's that grand struggle between balancing lives and livelihoods. Some results from the tighter measures, but it is not time to celebrate. 2 weeks ago, we introduced tighter measures for the period August 20 to September 7. While we are starting to see some early signs of improvement, as we have seen in the decline in the R0, the advice of our public health experts is that we need to extend the current measures, the current restrictions, for another 2 weeks. The COVID-19 subcommittee of cabinet met yesterday till very late, and we decided on the following measures effective February, September 3 until September 17th, 2021. Curfew hours. The existing no movement days will be continued for another 2 weeks. Therefore, we will be seeing 6 more no movement days. And these would be Sunday, September the 5th, Monday, September the 6th, Tuesday, September the 7th, Sunday, September the 12th, Monday, September 13th, and Tuesday, September 14th. The normal curfew hours will be 7 p.m. until 5 a.m. the following morning on Wednesdays to Fridays during this period, and 6 p.m. on Saturdays. To allow persons to prepare for the 3 consecutive no movement days, on Friday, September 3, on Friday, September 3, and on Friday, September 10, 2021, workplaces, businesses will be required to close at midday. The list of workplaces and businesses which will not have to close at midday remains the same as the last 2 weeks of no movement days. And these businesses are published in the Gazette, which is available online, and we will have the Gazette available much earlier than previous times. Despite the extended curfew hours, we want the vaccination program to continue in full force. Certain vaccination sites will remain open during curfew hours and on no movement days. Persons who wish to receive the vaccine will be allowed to do so during curfew hours, as was done over the last 2 weeks. To be clear, on no movement days, persons will be allowed to seek urgent medical care, and those who have overseas travel plans can make their way to and from the airport. Essential services will be operational, and in this group I include our fisher folk, farmers, our factories, BPOs, and those involved in the maintenance of infrastructure and for financial services, and indeed the media. But I remind those persons employed to essential services who must move on the no movement days to ensure that you have your ID to present to the police in case you are stopped. Even in this group, those persons who can work from home should do so and only travel if necessary. We have heard the concerns of our frontline workers about obtaining meals while on duty on no movement days. We will allow the JCF, the JDF, private security personnel, the fire brigade, doctors, nurses, pharmacists, or other persons properly identified, employed to the hospital or engaged by the Ministry of Health in the vaccination process to be served at the premises of food establishments which are registered under the ENS program, that is the e-commerce national delivery system, during curfew and no movement days. Just to give you a brief update on the ENS continues to be operational, and we encourage persons to use the system. Businesses and delivery operators registered on the ENS program will be able to operate after curfew until midnight on no movement days. Work from home. The existing work from home directive in the public sector is being extended until September 17, 2021. Again, I urge permanent secretaries and heads of agencies to strictly ensure that only persons who work in critical service delivery, and the nature of their work is such that it requires them to be physically present at the office or plant, that only those persons be allowed to come to work. For the private sector, I again use a strong appeal to employers to ensure that only persons who cannot work from home actually come into your workplaces. For places of worship, and again, I've seen the appeals of our pastors saying, look, we have these large spaces and we could accommodate more persons. We have been very faithful in observing the rules and so forth. I quite well understand that it is not our intention to deprive anyone of their right to worship, but it is just necessary for the management of the pandemic. Schools would have the same argument. See, we have these schools that are in rural areas that are empty, and many of them are underpopulated. Why can't we have schools? It's the same principle that applies. So for places of worship, the same arrangements that were in place over the last 2 Sundays to facilitate Sunday worship will remain in place for Sunday, September 5 and Sunday, September 12. Persons who leave home on these 2 Sundays will have to carry on their person an authorization form as included in the Gazette, issued by their place of worship. In respect of funerals, weddings, AGMs, or other gatherings, the same provisions remain in place as obtained over the past 2 weeks. Just a quick update on vaccination. As of today, 549,837 doses of vaccines have been administered, and over 408,000 Jamaicans would have by now received at least 1 dose. I'm glad that we have been seeing an increase in uptake of the vaccine in recent days. Earlier today, I visited St. Thomas, and Minister Tufton, who is online, is in Hanover, which is why he's not here with us. And we chose those 2 parishes because when we examine the data for take-up, Hanover and St. Thomas had the 2 lowest percentages for take-up. So it does select, those 2 parishes select themselves for special and direct attention to get that population to take the vaccine. I believe that there are a number of Jamaicans who have questions and concerns about the vaccine and how it may affect them. And in fact, that's what we have seen when we have moved about and engaged with the people. I haven't come upon any hardened, strong anti-vaxxer. Obviously, there are persons who hold these strong views, and I respect your views. It's not my intention to try and convince you. My intention is to present you with the information. But we have met upon more persons who simply just do not know, and that lack of knowledge leads to a lack of action on their part. They just don't know, and they have questions. So we met upon a lady who, for example, said, well, I have a situation and I have to check before, and obviously she had a heart condition and she was uncertain. So my advice to her was, go and talk to your doctor just to be sure. But, if you were to contract the disease with your heart condition, your probability of a fatal event is far higher than if you had the vaccine. Obviously, we are not doctors, so we can't give any medical advice. We're merely presenting the information as documented and packaged by the Ministry of Health, and we are there giving moral suasion and encouragement. I note the concerns raised by the opposition spokesman on health, and some calls that have been made to talk show about us moving around during this period. It should be noted that our movements are well regulated and controlled within the protocols, and everyone who is around us, certainly my team, is vaccinated. We all wear masks. We all, as best as possible, try to maintain the social distance. I wasn't 100% satisfied with actually visiting the vaccination site, which is quite different from from the tour. When we went there, the sites were crowded, people were coming out. And we have seen this right across the country as people turn out to get vaccinated. It is part of the risk, and we will be meeting with the Ministry of Health to have that special discussion about how do we control the sites. We will be saying some more about how we're going to be managing the vaccination process, just to make sure that it is safe, it meets the standards, but also that it is convenient. So from our perspective, the urgent and critical and immediate priority is to increase the number of vaccinations. And I make the point to you that a couple of days ago, we did 20,000. Another couple of days ago, we did 12. Today, we had 5,000. So, you know, we need to be out there mobilizing. There is a sense that fear is going to drive people to take the vaccine. Fear will only carry you so far. It is knowledge and empowerment by knowledge that will keep the numbers and the take-up very high. So we have to continue with our program, but we do so with the greatest respect for the protocols and the safety of all involved. In order to ramp up our vaccination program, after discussions with the Ministry of Health and with some of our stakeholders, we have concluded on a methodology. So we have a vaccination plan which has already been announced. Now we have to operationalize that plan. We have to put in place the structures and the mechanisms to make sure that the plan works. The plan, you know, and so far in terms of its operationalization, has largely depended wholly and solely on the Ministry of Health. Now we have to expand that plan with the supervision and direction and standards and the parameters set by the Ministry of Health and regulated by the Ministry of Health. But it is clear that if we're going to meet the vaccination goals, we have to pull in more stakeholders. And it is always very difficult because you have entrenched positions, people have perspectives on how things should be done, people have professional positions on how things should be done, and others have what they consider to be practical positions on how things should be done. And the dynamics and the politics of that is not always easy to navigate. And so, yes, there might have been a little bit of slowness in how we resolve that, but I think we are close to coming to a point now where we would have a very robust, well thought out system of expanding and ramping up the vaccination operationalization plan. And so you're going to see outsourcing and contracting of the service, and you will see that commence very soon. An announcement should be made. You will see that go through a procurement process of bringing in private contractors, and that will obviously include members of the private medical profession who would come in and assist. We have scaled up the involvement of the private sector through what is called the Private Sector Vaccination Initiative, and that is going to be focused on a sectoral industry approach. So, for example, in collaboration with the private sector, we want to rapidly increase vaccination in the tourism sector. And you can see strategically why you would want to do that. We would rapidly want to increase vaccination in the BPO sector. These are kind of closed ecosystems that have everything for them to operate. And if they are in a closed ecosystem and they are fully vaccinated, the impact of what you would call, national measures would be less on them because they have reached that level of immunity. We're looking at, the construction industry, financial services, quick services, retail, private security. And I see the Minister of Education here, and she's saying, what about education? What about education? Yes, the Ministry of Education, Youth and Information, and the Ministry of Health and Wellness will continue to ramp up the school-based vaccination program, Minister, to facilitate a return to face-to-face learning for schools that are able to achieve vaccination rates of 65% or more. So you will hear more about that from the Minister of Education. We take the view that, schools are a very good point of organization, and if you bring in the principals, they are able, more than anyone else, to mobilize parents and teachers to come and take, and students obviously, to come and take the vaccines. So, friends, fellow Jamaicans, Jamaican family, it is a difficult time. In driving here, I heard an excellent interview by one of our nation's highly regarded psychiatrists, psychologists, saying that the mental health, we should pay attention to that during the pandemic, and it's a serious point. And I know that many people are panicking, many persons are distressed, and a lot of people just don't know what to believe, what to think. But someone who was also being interviewed said something that's very important, that now is not the time to panic. And it is one thing that I don't do ever, is to panic. And I don't think that Jamaica should panic. We have this situation under control. It is not a situation where obviously we have all the variables under control. It is not a situation where things have not happened that should not have happened. But in general, I think we have done what is necessary to bring the situation under control and to rapidly bend this curve. And I think that the measures that are in place, and you would have seen, it is doing that. But just quickly to add to that, it is not a time for us to relax. We have to drive through with these measures. We will bring the numbers down. And when we bring it down, I'm certain that we will end this argument about opening up and then having to close down. I think after this episode, there will have to be a greater balance and understanding that sectoral interests can't push the government into decisions that affect the entire society. This is a democracy, and this government, more than any, listens to the people. But at the same time, we have powerful interests. And when the consequences come, you can't find anybody. It wasn't their fault. They didn't ask for it. They didn't play any role in it. They didn't keep what they used to keep. But their voice was very loud in asking for and demanding even, protesting even, for us to reopen the economy. I have to make these political points because nobody else is making them. But I am very frank, as you know, and I'm going to call it as it is. There will be a different type of management of the pandemic going forward. This hide-and-seek business, opening up, closing down, can't work. The economy can't work like that. So the solution is for us to take the vaccines. And I'm being clear on that we are going to push very hard to empower our people with information until we have the majority of Jamaicans taking the vaccines, at which point we will push even harder to have those of our brothers and sisters who are resistant and reluctant, to encourage them strongly to take the vaccines. In closing, this morning in my usual reading, I came across an article, just as I had come across an article on the current strain. There is a new strain being studied in South Africa. So what it is saying to us is that as we are here, skirting around the issue of vaccines, there is a population remaining which will be the source of new strains of the virus coming into being. And I just have to call it as it is. Yes, we are a democracy. Yes, you're free to say what you have to say. But I also have a responsibility. As you can preach your message of dystopia and disruption and subversiveness, I will be as loud, I will be as strong in preaching the message of us being wise to the problem, of us being responsible to each other, and of us being smart enough to do what is necessary to preserve our life, our way of life, and our freedoms. My brothers and sisters, I thank you for listening, and I beseech you, take the vaccine.
Please remember to subscribe, like, share, and click the notification bell for daily updates.